Your toenails say more about your health than you think. Most people look at their toenails and see nothing more than something to trim and polish. But as a podiatrist with over 25 years of experience, I can tell you that your toenails are actually windows into your overall health. They can reveal signs of diabetes, circulation problems, nutritional deficiencies, and even serious conditions that need immediate attention. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas. In my practice, I see patients every day who could have prevented serious foot problems if they had just understood the basics of proper toenail care. Today, we're starting a comprehensive series called Toenail Health 101. And this first module is going to give you everything you need to know about everyday toenail care to keep your nails strong, healthy, and looking their best. But before we dive in, I want to make sure you don't miss any of the valuable information I share. Please take a moment to hit that subscribe button and ring in the notification bell so you'll be notified when I post new videos. Also, follow me on social media. You'll find those links in the description below. I've also written a comprehensive book all about toenail health and care, and I'm happy to send it to you absolutely free. Just visit www.mytoenailbook.com to request your copy. The link is right there in the description. Let's start with something that might surprise you. Your toenails are actually diagnostic tools. When I examine a patient's feet, I'm not looking for obvious problems. I'm reading their toenails like a medical chart. Toenails can reveal diabetes through changes in color, thickness, and growth patterns. Poor circulation shows up as slow-growing, brittle nails. Nutritional deficiencies manifest as ridges, white spots, or unusual textures. Even autoimmune conditions like psoriasis can first appear in toenails before affecting the skin anywhere else. That's why proper toenail care isn't about appearance, it's about your overall health. Now let's talk about how toenails actually grow, because understanding this process is crucial for proper care. Your toenails grow from the nail matrix, which is located underneath your cuticle at the base of the nail. Unlike fingernails, which grow about 3 millimeters per month, toenails grow much more slowly, only about 1 millimeter per month. That means it takes 9 to 12 months for a great toenail to completely grow out from base to tip, and about 6 months for the smaller toenails. This slow growth rate is why toenail problems take so long to resolve, and why consistency in treatment and care is absolutely critical. Let's get to the most fundamental aspect of toenail care: proper trimming technique. I can't tell you how many problems I see in my office that could have been prevented with correct nail trimming. Here's the step-by-step process I recommend. First, timing matters. Never cut your nails when they're wet or soft from a shower or bath. Wet nails tear instead of cutting cleanly, creating microscopic damage that can lead to ingrown toenails. Wait at least 2 hours after showering, or better yet, trim your nails when they're completely dry. Second, use the right tools. You need professional grade straight across toenail clippers, not the curved fingernail clippers you find at the drugstore. Those curved clippers actually encourage the nail to grow in a curved pattern, which can lead to ingrown toenails. Third, the cutting technique. Cut your nails straight across, not following the curve of the toe. Leave about 2 millimeters of white showing, about the thickness of a nickel. Never cut into the corners or try it around the edges. That's where most people go wrong. Fourth, file the edges. After cutting, use a nail file to smooth any rough edges. This prevents the nail from catching on socks or shoes. Now, there are exceptions to every rule. Some people have naturally curved nails, and cutting straight across will leave sharp corners that dig into adjacent toes. If you have curved nails, you may need to gently round the corners after cutting straight across. But do this with a file, not clippers. When should you see a podiatrist for nail care? If you have diabetes, poor circulation, or vision problems that makes it difficult to see your feet clearly, or if you have thick, difficult to cut nails, or if you've had recurring ingrown toenails, we can show you the proper technique for your specific nail shape. Let's talk about foot hygiene, which is just as important as proper trimming. Keeping your nails and feet clean and dry is your first line of defense against fungal infections, bacterial infections, and other problems. Here's what you need to know. Wash your feet daily with soap and warm water, making sure to clean between your toes and around the nail's edge. Dry thoroughly, and I mean thoroughly. Moisture trapped around the nails creates the perfect environment for fungus growth. In public showers and locker rooms, always wear shower shoes or flip-flops. The floors in these areas are breeding ground for fungus and bacteria. Never walk barefoot in public pools, gym showers, or hotel bathrooms. Change your socks daily, and if your feet sweat heavily, change them twice a day. Choose moisture-wicking socks made from synthetic materials or merino wool rather than cotton. Cotton holds moisture against your skin. Now let's discuss nail and skin products that actually help, because there's a lot of misinformation out there about what works and what doesn't. When it comes to moisturizing, timing and product choice matters. The skin around your nails becomes dry and cracked, especially in the winter if you're frequently in water. Dry, cracked cuticles are entry points for bacteria that can lead to infection. Look for urea-based creams. Urea is a natural moisturizer that's particularly effective for thick, dry skin around the nails. Apply moisturizer to your feet and nails at bedtime and make sure your feet are completely dry first. Avoid over-moisturizing between the toes, as this can cause a breeding ground for fungus. Focus the moisturizer on the tops and bottoms of your feet and around the nail areas. I want to tell you about a product that I recommend to many of my patients, Toenail Nail Renewal. This is a unique product that combines antifungal properties with cosmetic benefits. Toenail contains ingredients that help to prevent fungal infections while also improving the appearance of damaged or discolored nails. It's particularly useful if you have nails that look unhealthy but don't have an active fungus infection, or if you're prone to recurring fungal problems. The antifungal components help to maintain a healthy nail environment, while the cosmetic ingredients can improve the appearance of yellowed or damaged nails over time. Let's talk about common bad habits that I see patients doing that actually damage their toenails. Never peel, tear, or rip your nails. I know it's tempting when you see a loose piece of nail, but tearing creates jagged edges and can damage the nail bed. Always use proper nail clippers or a file. Be careful with nail polish and pedicures. While there's nothing wrong with polishing your toenails, overuse of nail polish, especially leaving it on for weeks at a time, can cause the nails to become yellow and brittle. Give your nails a break between polish applications. Poor pedicure practices can be dangerous. If you go to a salon, make sure they follow proper sterilization techniques. Better yet, bring your own tools. Never let them cut your cuticles or dig into the corners of your nail. Shellac and gel polishes should be avoided on the toenails. They seal the nail completely, preventing it from breathing, and can cause significant damage when removed. Now I need to address special considerations for at-risk groups, because proper toenail care can literally be a matter of life and limb for some people. If you have diabetes, toenail care is never routine. Diabetes affects your circulation and nerve sensation in your feet, which means small problems can become serious infections. Daily foot inspection is crucial. Look at your toenails and the skin around them every single day. Look for cuts, cracks, redness, swelling, or any changes in color or texture. Never attempt bathroom surgery on ingrown toenails or other nail problems if you're diabetic. What seems like a minor issue can lead to serious infection and even amputation. Many of my diabetic patients benefit from regular professional nail care. It's not a luxury, it's preventative medicine. For seniors, nail care becomes a safety issue as we age. Nails naturally become thicker and harder to cut. Vision problems, arthritis, and balance issues can make nail care difficult or dangerous. Thick nails shouldn't be ignored as they can cause pain, making walking difficult and leading to other foot problems. If you can't safely trim your own nails, see a podiatrist regularly for professional nail care. Let me give you some final thoughts on maintaining healthy toenails. Consistency is key. Good toenail care isn't something you do once in a while, it's a regular routine. Trim your nails every 6 to 8 weeks, inspect your feet daily, and maintain good hygiene. Don't ignore changes. If you notice any changes in your toenails, color, thickness, or texture, or growth pattern, don't assume it's normal aging. Many serious conditions first show up in the toenails. Invest in quality tools. Good nail clippers, a proper file, and quality foot care products are worth the investment. Cheap tools can actually damage your nails. When in doubt, ask a professional. Podiatrists are trained to recognize and treat all kinds of toenail problems. Don't suffer with painful or unsightly nails when help is available. If you found this information helpful, please hit that like button and share this video with anyone who might benefit from better toenail health. Your simple share can help someone avoid serious foot problems. Subscribe to the channel and follow me on social media for more foot health content. The links are in the description below. Don't forget to get your free copy of my toenail health book at www.mytoenailbook.com. It contains detailed information about everything we've discussed today, plus additional tips and treatment options. And if you're dealing with any toenail problems, whether it's thick nails, discoloration, ingrown toenails, or anything else that doesn't look right, don't wait. Contact our office to schedule an evaluation. The link to request an appointment is in the description below. Remember, your toenails are more than just something to trim and polish. They're indicators of your overall health. Take care of them, and they'll take care of you. Thanks so much for watching, and have a great day.